Good morning, everyone. Thank you for joining us today. My name is Lance Madigan. I'm with the Intermountain Healthcare Media Relations team, and this morning we're joined by Dr. Andy Pavia, Chief of the Division of Pediatric Infectious Diseases at the University of Utah Health and Director of Hospital Epidemiology at Intermountain Healthcare Primary Children's Hospital. This has been quite a busy week with vaccines becoming more available and new variants being identified. I know we just learned about it, but to start with, Dr. Pavia, why don't you give us a brief update on what we know of Omicron to this point?
So let's start with the really important caveat that we don't have all the answers on Omicron, and anything that we say is based on very early and tentative data, and people just need to be patient until we have better science. But we know that it's spread pretty widely around the world. We know that it's here in the US, and that several of the cases clearly were infected in the US, so transmission is ongoing. And we expect in the next couple of days, we're going to find out that there's a lot more Omicron that's already here. We know that it is pretty easily transmitted. In the last few days, we've seen data from South Africa showing the rapid rise. We don't know for sure that it's more transmissible than Delta, but it is much more transmissible than earlier strains. So it is going to spread, and that much I think is pretty clear. Will it outcompete Delta? We don't know. We also know with some certainty, or at least can predict with some certainty, that the mutations in Omicron are going to make some of our monoclonal antibodies not work very effectively. So we are going to lose some of those tools if Omicron becomes really widespread. We don't have definitive answers about vaccine yet, which is what everyone wants to know, but we can make some very educated guesses based on what we've seen with other variants with similar mutation patterns. And that is that there's already some evidence out of South Africa that Omicron is better at causing reinfection of people who were previously infected. But it's also a pretty good prediction that our vaccines will provide some protection, probably a very good level of protection against hospitalization or death, and probably will be less effective at preventing breakthrough milder infections. The other thing I think we can say at this point is that we know that getting 2 doses of vaccine and a booster, or having been infected and getting 2 doses of vaccine, gives you much higher antibody levels that are much broader, and broader antibodies are more likely to work against a variant such as Omicron.
Excellent. And then to that point too, we've had the new vaccine for 5 to 11-year-olds. We probably don't have much data on how that's reacting with kids either.
Well, we have some great news about the vaccine for 5 to 11-year-olds, and that is that the uptake's pretty good. As of today, we'll be over 70,000 kids 5 to 11 in Utah have been vaccinated, which I'm delighted at. It means parents are really embracing it. We've not seen serious side effects. We've not heard about any nationally. Remember that safety surveillance is ongoing in real time, so things will change over time. But with well over 1 million doses given to kids in this age group so far in the US and 70,000 in Utah, it's looking really good. Now, is it going to protect kids any differently against Omicron than adults? We have no idea, but there's no reason to think that it's going to be any different.
Awesome. And let's just stay on children and pediatrics for just a minute here. We've heard some parents talking about taking a wait and see approach to see how safe the vaccine is or how effective it is for kids. What is your kind of guidance and thoughts on that?
Well, I really don't think anyone should wait, although it's an understandable feeling. So a couple of things. First of all, if you wanted to wait until it was in a larger number of kids, 1 million's a pretty good number. So I think you should start to feel pretty good about it, even if 3 weeks ago you were a little bit more cautious. Secondly, when we think about our kids, let's realize that the holidays are coming up and they need to get their second dose in to start to have really robust protection. So if you want that freedom from fear, that peace of mind of having your kids protected as they go out on Christmas vacation, get together with family and friends, then now is the time to get started on a vaccine, and you really don't have much time to waste.
Yes, that those holidays are right around the corner. And likewise, what about other vaccines administered alongside the COVID vaccine, like influenza?
So that's a good reminder to everyone, is that we can give all of our other vaccines on the same day that we give a COVID vaccine. And we've now given many, many children, teenagers and adults, influenza at the same time as COVID vaccine. There are no safety signals from that. There's been one formal study done that shows there's no increase in side effects. But both vaccines can have side effects, and although the flu vaccine has relatively few side effects, if you get two vaccines on the same day, there's a higher chance of some achiness, fever, sore arms, etc.
Yeah, you're speaking there. Why don't you just remind us again what those most common side effects are and what people need to look for, or maybe the ones that would be more concerning that you would want
Yeah.
to necessarily go back to your doctor for.
So the really good news is that serious or life-threatening side effects have been extraordinarily rare. And we really don't have any indication that they're even as common in kids 5 to 10 as they are in teenagers and adults. But minor and annoying side effects are pretty common. And those include sore arm, which about 70% of kids and about the same amount of adults will have, fatigue, aches, muscle aches, and joint aches are really quite common. Fever is a little bit less common, but it can certainly occur. And you can also get swollen lymph nodes in the armpit or neck. These are all part of the immune system responding to the vaccine. They can be annoying. You can treat them with Tylenol, ibuprofen, naproxen, and they go away pretty quickly. But you have to anticipate that they can happen, and you shouldn't be alarmed. But you have to just bear with it. It is the price of really good protection.
And always better than having the disease itself.
It's yes, the side effects of the vaccine are, even for those who have a day where they need to stay on the couch, are a tiny fraction of what the vast majority of people get infected develop. And you have no way of knowing what your case of true infection is going to be like. Is it going to leave you with permanent heart damage? Is it going to kill you? Is it going to leave you with long COVID? Those are all unknowns. With a vaccine, you have a chance that you're going to be tired and achy for 12 to 24 hours, and that's about it.
Awesome. One other that may be kind of an unknown at this point, but ask anyway. What's the likelihood, or is there any indication that children are going to need a booster at some point?
We really don't know. Those studies are ongoing. The teenagers who were in the study that led to the licensing for teenagers, some of them are coming up on about a year out. So as we look at their antibody levels over time, we're going to get a pretty good idea. My sense is that we're learning that the best way to give the mRNA vaccines, the Pfizer and Moderna, may be that 3-dose series. So it may be that it just is the best way to give long-lasting and broad protection, good protection against the possibility of variants. That's just a guess. We're waiting for more data on kids, but I suspect that, like hepatitis B vaccine or our pertussis vaccines, that this is really probably best done as a 3-dose series.
Okay, great. Okay, we got a couple questions from our friends in the media. Jed Bowl asks, if people are fully vaxxed and boosted, how safe are people to gather and travel?
Well, it's always hard to define how safe, but I think that if you use other sensible precautions and you've had vaccine and boosting, you can really begin to venture out pretty safely. And by reasonable precautions, I mean, you still should be wearing a mask in indoor settings where you're going to be around unvaccinated people or crowds. When you're at your relative's house and everyone's vaccinated and boosted, I personally would take the mask off as long as they've been reasonably careful as well.
Excellent. And then a couple questions specific towards Omicron. First, are symptoms with Omicron different?
We don't know yet. And anybody who tells you they know is basically responding to stories and not to real data. We'll learn that in the next 2 weeks or so. And you have to be aware that some of the experience in South Africa so far is going to be a little bit one-sided because Omicron originally was detected in clusters that were happening in young people, predominantly college-age people, where the symptoms are likely on average to be milder. So we'll learn more as we see it spread more broadly and we see a broader range of groups of people infected. So be patient. We'll have answers soon, but we can't make stuff up right now.
And I think that you just answered this as well, but any indication yet if Omicron will be more severe in kids ages 5 to 11?
Absolutely no information so far. I think we have to assume that we now know that kids are at pretty significant risk of disease from SARS-CoV, from COVID in general, and we can't pretend that kids are completely safe. But whether Omicron is going to be the same as Delta, milder or worse, it's going to take us a little bit of time to figure out.
Great. Another question. With the 2 US cases this week, speaking to Omicron, what's the likelihood that Omicron is already here in Utah? And how should Utahns treat that possibility?
So it's 10 cases as of this morning, and it's going to change by the hour today. There's a cluster of 5 in New York City. There's cases in Colorado, California, and Minnesota. So if you just look at that map, I think it is highly likely that if it hasn't reached Utah, it's a matter of days. We have a pretty good surveillance system with sequencing. We're better than most states in being able to do that. But there's still a lag time between when you get sick, when you get tested, and when the specimen goes to the state lab. And if you get a rapid test, we can't do sequencing. So I think it's in Utah. And if it isn't, it will be soon. I think that we know how to deal with Omicron. We're just not doing it all the time. Get vaccinated if you're not vaccinated. Get boosted if you're vaccinated. And wear a mask in indoor settings where you're around other people, be that a classroom or a grocery store, crowded space. These are going to work against Omicron. What isn't going to work against Omicron is saying that we're tired of the pandemic and we're so done with it that we can't take precautions. That's going to lead to a lot more illness. And I do want to remind everybody that we're not done with the Delta surge. In the last 3 days, Utah is going to report roughly 2,000 cases a day. We're still seeing a lot of cases in children. About 1 in 5 are in school-age kids. So everyone's focused on Omicron, and the press is understandably very interested in it. But we're still getting hammered by Delta, and we need to get it under control.
Yes, that's a good segue into Jamie Lampros's question. What are we seeing right now at primary children's? And I don't know if you can speak more broadly to ICU capacity across the state.
Yeah, so at primary children's, we're still very, very busy. We've got the combination of a fair number of kids with COVID, and we're still seeing RSV. We have staff shortages. So we're running pretty close to 100% occupancy most days. We're doing a little bit better than we were a few weeks ago, but I am worried about a Thanksgiving surge. The numbers are up for the last 2 days, and they're going to be up again today. So we don't have a lot of reserve. And that's true for our ICUs. Our ICU doctors and nurses are beyond exhausted. I've said this over and over again, but I think we really, if you haven't been there, if you haven't been in that kind of combat with the virus, you don't know what it really means. And our adult ICUs remain really crowded and largely at capacity across the state. And largely, we're at the limits of what we can do with staffing. If we had more staff, we have spaces we can expand into, but we can't invent nurses. We can't invent ICU doctors. They take years to train.
Absolutely. Let's see, I lost my track. Along those same lines, what is our timing? You talk about a surge that we might see out of Thanksgiving. What would be the timing for something like that if we were to see it?
Well, typically it takes 3 to 5 days for people to develop symptoms, another 1 to 4 for them to seek healthcare. It may take a little bit of time for it to get into the reporting system. And then about a week more for people to get hospitalized. So right now, about a week out from Thanksgiving is about when we should start seeing the impact of infections in our case counts. And if we do see an increase in our case counts, which I really, really hope is not happening, then we're going to see a surge in hospitalizations towards the end of next week. I hope I'm wrong, but I think it's always better to be prepared rather than to pretend everything is going to be okay and then be caught flat-footed and unprepared.
And do you think that the potential surge and emergence of new Omicron variant, those things will have impact on vaccine interest?
Well, I hope so. I mean, I hope that everyone is interested in getting vaccinated to begin with. But the truth is, of course, we've got a real problem here in Utah. We've got, about 1.4 million people who are not vaccinated yet. And we've kind of, we've slowed down the ability to get those unvaccinated folks vaccinated. I think Delta alone should have been enough reason to get vaccinated, but perhaps concern about Omicron should really get people's attention. If the data that were just released from South Africa today, it's just a preprint, are correct, then Omicron is very good at causing reinfection among people who were previously infected. So people are counting on having been previously infected as protecting them, really should go out and get vaccinated to protect against Delta, but even more so against Omicron.
Okay. KCPW is asking, regarding COVID vaccines, the Utah Department of Health urges schools to promote vaccination in K through 12 schools for students and staff. What roles can schools play? What would you like to see schools do with regards to vaccination?
As somebody who had kids in school for many years, and as a pediatrician, we know that if you make vaccination convenient, people are more likely to do it. Parents are busy, they can't take time off from work. So having vaccine clinics near schools or at schools that can allow the whole family to get vaccinated, the kids who need it and the parents who may not have had a chance yet, works extremely well. Places that have pioneered that, like Davis County here in Utah, have found that it really helps us get vaccination rates up and it makes parents' lives easier. And I think that's what we should be doing across the state. I know there's a variety of political opinions and there are parts of the state where there's pushback. It's often a vocal minority. And I wish people would listen to the majority of parents and do what's best for the majority of kids and not listen to those who shout the loudest. But sadly, I think sometimes it's the minority that shouts that influences what we do.
Speaking of sometimes loud minority voices, we're getting questions from Facebook about natural immunity and how that differs from vaccine immunity. I can't talk this morning. Why don't you discuss? I know you've talked about that in the past, but
Sure.
Why don't we go ahead and touch that one again?
Yeah, let me go over that because I think the data are becoming ever more clear, although it's still, immunology is complicated and it's hard to simplify it too much. But immunity after infection, so-called natural immunity, it's not like going to the health food store and getting something that's from nature and safe, does provide some level of immunity. But compared to vaccines, it has a number of disadvantages. The first and most obvious is that you can die trying to get natural immunity. The second is that the level of protection varies a lot person to person. The antibody levels after vaccination are pretty good for almost everyone, with a few exceptions. But many people who were infected have very weak immune responses to the virus. Others have excellent immune responses. So you don't know which one you are. And we still don't have commercially available tests that can give you that answer. The milder your infection, the shorter your protection will last, and the less complete it's going to be. The other thing is that we're learning that the breadth of protection, and this is a little bit surprising, seems to be best after a 3-dose series of vaccine, much more so than after immunity from real infection. Now, why is that? We don't know exactly. We know that the viruses that were circulating a year ago that many people in Utah were infected with are very different than Delta and even more different than Omicron. So your protection may not be adequate. We also know that the immune system does really well when it gets repeated exposures. And something called affinity maturation occurs, which I won't go into detail, but it means that basically you refine the level of protection. Not only do you increase the amount of antibody, but the degree to which those antibodies are highly effective improves. And that's why the 3-dose series, the boosted series, seems to work so well. I was a bit of a skeptic 3 months ago as to whether everyone should get a booster because I wanted to see more data. The data are now becoming pretty clear. And I think based on that, I'm convinced that for most of us, getting boosted is the right thing to do.
Okay. Also, kind of along those same lines from Facebook, talk about what we know about the efficacy of the vaccine for kids compared to that of adults. We know it's been in adults a lot longer, it's been studied a little bit more, but we're starting to get data on the children as well.
So we have new data on the long-term efficacy in teenagers going out beyond 6 months. And the efficacy looks to still be pretty close to 100% against symptomatic disease and hospitalization. I don't think it's really 100%. There will be mild cases and breakthrough, but it does look like teenagers are having efficacy that is, if anything, better than adults. And that's something we might have predicted from the antibody levels. We don't have significant efficacy data on kids 5 to 11 beyond what was in the trials. But if you remember in the clinical trial, the vaccine was 90%, almost 91% effective at preventing symptomatic disease. And I expect as we get the large-scale follow-up data, that is going to be what we continue to see. Now, I think everyone wants to know, is my kid going to need a third dose, a booster? And we can't know that for kids who were just vaccinated in the last 3 weeks or in the trials 3 to 4 months ago until we collect some more information. If I had to guess, I would guess that a third dose is going to be important for everyone, but we don't want to rush out there until we have a little bit more information.
Okay. Looks like we got one last question at the moment from Yara at the Dixie Sun. I'm going to just reword this just a little bit. Looking at the vaccine manufacturers, we know why don't you talk just a little bit about how they're researching and the possibility of a new formula, so to speak, for the vaccine, either for Omicron or for other variants. What does that look like? What is that process?
That's a great question. Because of the way the mRNA vaccines are made, it's actually pretty easy to redesign the sequence that goes into the RNA that matches a new variant. So it didn't turn out to be very helpful against Delta. It turned out that a booster worked just fine. Against Omicron, it may be needed. We may need to make changes in the vaccine. We know that both Pfizer and Moderna are designing potential vaccines that have spike protein that looks like the changes that we see in Omicron. And the idea would be that they're going to try and think ahead. They're going to try and design something that worked for Omicron and potentially other mutations that we've learned about. That's going to be an imperfect science. It's going to take, and they've put out timelines, it's going to take a matter of weeks to get first test batches, but it's going to take a couple of months probably to do clinical studies to show that they work in people and generate good antibodies. And in the meantime, we've got to figure out whether we need them, because a booster dose may be the answer, or we may need to come up with boosters that are more variant specific, more Omicron specific. And we need to move forward as if both could be the right answer until we know.
Excellent. Okay, and last question, we're just about out of time. What are the risks of other variants popping up?
Very high. This virus mutates, and it has shown that it's really flexible. It is evolving, and it's evolving to become a better pathogen, to be better at infecting us and spreading. And the only way that we're really going to control the emergence of variants is to decrease the number of infections. And we can't do that by just decreasing the number of infections in the US. We have to decrease the number of infections around the world. Until we have vaccinated a large proportion of people everywhere, there is a risk that the virus will continue to evolve and be with us. The saying that I used early in the outbreak, and I'm going to use again, is no one's safe until everyone's safe. We need to redouble our efforts to help vaccinate our neighbors and our neighbors around the world.
Excellent. Well, thank you, Dr. Pavia. Do you have any closing thoughts or recommendations you'd like to leave with our viewers today?
I mean, I want to impart a message of some optimism. We have the tools to combat Omicron. It's not the end of the world, but we're not using them. If you're not vaccinated, get vaccinated. Do it now. If you've been infected, get vaccinated. If you've had 2 doses, get your 3rd dose. That's what we're pretty sure it's going to take to get your level of immunity up. And in the meantime, there are simple measures that help prevent spread. So, you may be sick of masks, but they're with us for a while and they really, really make a difference. So go out there, protect yourself, get to spend time with your loved ones and your friends over the holidays, but do it safely. And happy holidays.
Excellent. Well, thank you again, Dr. Pavia, and everyone else for joining us today. As mentioned, we've been talking with Dr. Andrew Pavia, who is the Director of Hospital Epidemiology at Intermountain Primary Children's Hospital and Chief of the Division of Pediatric Infectious Diseases at the University of Utah Health. For members of the media, we'll be sending you the link to download the broadcast later today. Thank you to everyone, and please stay safe.
Thanks, Lance, and thanks to everyone for your attention.